Super late, but we're here, y'all. Let's go ahead and rock with it. Uh, quite the day, but we're here. Welcome to the late night show, Dr. Kojo. This is a special segment. This is the Ask Dr. Kojo segment. You can ask me any question, mental health related, whatever. I just want to, get back to my community and answer as many questions as possible. So before we start, as we always have to do, I introduce myself. I say where I'm from. My name is Kojo. I'm checking in from what was sunny Los Angeles, California, and now it's nighttime. So let me know where you all are checking in from, and then let's get to these questions. We got Mississippi in the house, and if you ask a question early on, ask that question again, so that way when I say where everybody is from, we can get these questions. So please don't be afraid to ask twice. But I'll go up. So we got Mississippi in the house, Denver. Let me give out three more locations. Lancaster, Pennsylvania. I see Florida, and I see Clinton, Mississippi. Okay. All right. I'm ready to answer these questions now. Leilani, thank you. Man, these questions are all over. Oh, my. Wow. Yo, that's so many questions. They're coming so fast. All right, so this is the first one I saw. So, come down. So, this is a tough question, obviously, but I'm just going to answer the questions that I see. I'm not ducking anything. Obviously, mental health is my specialty, but when it comes to women's reproductive rights, I don't think that we should be. I don't think you can't ban abortion. You can only ban safe abortions. So if you ban it, you kind of force people to, go the unsafe route, which hurts all of us. And as somebody with ADHD, the ADHD community, sometimes with undiagnosed ADHD, you have early pregnancies and all kinds of stuff. So I would hope that the government would, support women on this one. But it's such a touchy subject. But I support the woman's right, and also the father, the family's right, to make their decision. All right, best way to fight no motivation, Rebecca, to do something, please, anything. If you have no motivation, just the smallest thing helps. All right, Lacey, no problem. It's a very, very touchy subject, but those are my thoughts. Maybe I'm not right, but those are my thoughts. Can you self-treat ADHD? I don't want to rely on medication for it. So, Carrie, it's funny because I saw a survey the other day. It wasn't an evidence-based study, but it was a survey where they were, asking people with ADHD what's the most effective thing for them. And in that particular survey, 90% of them said that it was medications. But there's so many other things. I know a lot of people. I've had many patients who have ADHD who didn't want meds, and they did well. Lifestyle modifications, getting exercise in, things of that nature. So, yeah. Do you think people can navigate mental illness through therapy without prescriptions? Depending on the condition and depending on what's going on. Because sometimes, you need meds, and sometimes, you might not have to take medications. Let me see. I'm just clicking. Whatever. Can you tell me what helps mania? I have a rapid cycling episode, and I don't know what to do. All right, so Erica, here's the thing with mania, right? So with mania, if you actually mean mania, you're not sleeping, right? So I will circle back to sleep. Sleep is so important for all of us, but especially if you have bipolar disorder. Talking about bipolar 1, bipolar 2, cyclothymia, rapid cycling, any sleep is so important. And obviously the correct answer is professional help. If you feel like you're in an episode and you feel like you're kind of losing your handle on things, professional help is very helpful. But if you can get well rested, make sure that you're staying safe. That's what we would do for you at the hospital, right? Someone comes in, they're manic, you give them mood stabilizers, let them sleep, and then after that, when they're ready to talk, you can try and process what happened. Derek says, do you think weed is good for ADHD? So here's the thing. I was having a conversation about cannabis, medical marijuana, THC, CBD with a friend yesterday, actually. And it's funny because I don't think cannabis, marijuana, I don't think it should be Schedule 1, I don't think it's the worst thing in the world. I even hate saying that. I don't think it's the worst thing in the world, but at the same time, a lot of people say like cannabis is harmless, that there's no risks to marijuana. I I clearly disagree with that because there's evidence that shows about some of the cognitive, impacts of marijuana. It can slow you down. There's a lot of negatives that we have there, but there's some positives that we haven't really done the evidence for. So right now that's why, and I don't tell patients, and if they want to do it, I can't stop them, but I'm not prescribing anybody any cannabis because it's not. We don't have evidence based information that says that THC helps for boom, 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 boom. But it could be helpful. I don't know, but I would like for us to do more research into it. So it sounds so weird saying that it's not the worst thing in the world, but it's not the best thing in the world. But we just need to do more research on it. Good question. Um, how to? Oh man, I wish I could answer everybody's. One of these days, I might do like a hour long of these because there's so many good questions. Help with overwhelming anxiety attacks. All right, so Anne Marie, overwhelming anxiety attacks. Here's the thing about anxiety and anxiety attacks. If you get them a lot, sometimes as soon as like you recover, you spend all your time when you're not having an anxiety attack. Sometimes worrying about the fact that you're going to have one soon. So I think, definitely, professional help is helpful. Some people have to take medications for their anxiety or anxiety attacks. If you can get to the root cause of the anxiety, are you putting yourself in situations that's making you anxious? So many different things. But I would definitely say professional help. Jace, what's up from Augusta? My fiance struggles with ADHD and we're tuning in together. Hey Vanessa, and hey Vanessa's fiance, how are y'all doing? What can we do to make sure conversations are both sided, controlling the? Oh, I love this question. Oh, Vanessa. Let me give Vanessa a love of the show. So here's a real simple trick, right? So not only for Vanessa and fiance, but anybody who struggles with this, I struggle with this a lot, right? So I don't know what my chain's out. I'm not trying to flirt with nobody today. So if you struggle with wanting to interrupt somebody, right? When they're talking, I want you to do two things. Do your best to have genuine interest in what that person is talking about, right? So that way you're not as worried about what you want to say. And the second thing is wash their mouth as they're talking, wash their lips, and if their lips, like if they're talking kind of fast and they're going through whatever they're saying, and as their lips kind of like stop and slow down, that's when they're ending their sentence, right? So if you can wash your lips, you can kind of pick up on when they're ending their sentence. So that way the conversation can flow naturally. Because believe it or not, like I've had friends who somebody interrupting them, like it can cause a meltdown, right? So have genuine interest in what they're talking about and watch their lips as they're talking. Thank you for asking that question, Vanessa. I appreciate that. How much should Corey? Are you saying behavioral therapist? Ah, is that what you're saying? So Corey, here's my thing. I think that in the mental health field, everybody should get a pay. Everybody in the mental health field should get a pay boost. For me, when I was doing forensic psychiatry back in Virginia, I mean, I'm making good money. So like, I didn't. I mean, if they give me extra money, okay, but like, I wasn't after more money. Uh, but I know some of the social workers were underpaid, and they were telling me, and I used to hate it because the social workers were the backbone of the team. They used to get all the information, man. So like, I'm not I don't do economics or anything like that, but like social work, like people should be paid, you know. So I almost felt guilty for like, sometimes making what I was making, seeing that some of my peers weren't making the same money. I used to hate that. Um, but even beyond that, I would like for mental health professionals to also have access to like therapy and services like that because nobody talks about that, but like we need that stuff, like I started going to therapy myself during the pandemic. uh, I interrupt when I'm manic. I hate myself interrupting. Erica, it's all good. Let's just work on this step by step. Let me get back to some of these questions. How do you deal with ADHD overwhelm when you grind hard but still feel behind? All right, so Emily, here's the thing. If you're grinding hard and you're still behind, that means that if you keep grinding hard the same way that you've been grinding hard, something might not change. So sometimes the best thing to do is to rest, right? Because if you have ADHD and you're grinding hard, sometimes you know that like you worked for like 2 hours in the morning and then you're grinding hard the rest of the day. But from 11 a.m. to 9 p.m., you were grinding hard, but nothing was happening. What if you took half that time and you took a break? So try to get some rest in. Try to get these questions. ADHD, I've tried all the meds. So Miranda, have you tried all the meds? It doesn't matter how high the dosage. Why am I? So Miranda, my thing is, I would. This is where professional help comes in. Like there's only so much that I can do here because if it looks like you need medications, I would talk to your provider, right? And make sure you've tried everything. Like I don't know if you mean that you've tried everything, like you tried like Vyvanse, Adderall, Focalin, Ritalin, Concerta, Strattera, Wellbutrin, um, clonidine, like intuitive. Like if you tried everything, then I mean, if I had a patient who had tried like everything, I would start back and I would review the diagnosis and I would do whatever I could to see what underlying thing I could fix. So I'm not doubting that you've tried everything, but just like go back and make sure you've tried everything and do your best to be patient. So, what is my dog eating? I have ADHD. I'm supposed to be on meds, but constantly forget even with alarm reminders. Any other ideas that have worked for yourself or others that you know for pill reminders? All right, so Sarah, I'm happy you asked this question. So I have like two main cell phones. Have some backups, but my cell phone is helpful. I have sticky notes. I have two computers, so I have sticky notes. None right here right now, so I gotta get some. But I have sticky notes on the computer, so when I wake up in the morning, so Sarah, this is what I do every single morning, right? Aside from my assistant sending me like my schedule for the day, so that way I know what to do. I just remember something that I forgot to do. Make you ficky. All right. See, look, Sarah. Sometimes you just forget things, and it's okay. It's okay. So we have to make it okay to forget things. Oh boy! But I'll put sticky notes like on the computer so that when I wake up in the morning, I know I know what to do. So sticky notes are like my little cheat code. Mickey Ficky, I'm forgetting things. Oh my gosh. So Brittany, please don't spam. But I got your question. I got your question. Have you had your patients try testing for medication interaction? I did it, and it saved me from trying so many medications for my anxiety and depression. All right, so Brittany, here's the thing. So if you have Brittany, if you have the privilege of being able to do this, right, and you got to the medication that helped you out, that's fine. I have nothing against genocide. I have nothing against them, right? Like I'm not promoting them, but I have nothing against them. But here's the thing: we live in a world where, look, for the 200 people who are watching and then the thousands of people who watch on the back end, there's already limited access to mental health resources, right? The average person is not going to, doesn't even have like a primary care provider to like talk to these issues about, so like, like genetic, like this is very expensive, so like, I mean, if you were able to do it, like I'm happy, that you were able to do that, but it's expensive and I don't know if it's practical for the average person who can't even see a doctor, but like, yeah, I got nothing against it. Um, you know, so she's about to say the same thing. Yeah, I have nothing against it, but like maybe like can we make it more affordable? Uh, Coping skills for BPD. So I love DBT, dialectical behavioral therapy, but to go a little bit deeper, there's a concept within it called radical acceptance, and that's where you accept everything radically. If something is bad, it is that bad. Let's go through it, and then we can react. If something is good, let's enjoy it fully, and then let's react. When you give yourself time to think about your actions, especially with BPD, it can help you from doing something that you don't mean to do. Like you love like your partner, you love your kids, you love your parents, so you didn't mean to say what you said to them, but it was hurtful and it may have like damaged your relationship, and that really sucks, right? Let me see. What are some of the advantages? Why is it important to get diagnosis as an adult? So I'm not sure what you're talking about, but here's the thing: with any diagnosis, like that's why people say, "Hey, do I have this? Hey, do I have that?" I'm like, hey, unless I saw somebody officially in the office, spend like an hour at a minimum. I don't like to rush like an assessment with a patient. Like back in the day, like I would hate, being on the clock, or like I hate people rushing me. Like don't rush me. I need give me like an hour with a new patient so I can ask all my questions. So when you do that and you get diagnosed, the knowing the diagnosis will tell the provider what treatment to go with. So I mean, I think in this country, unfortunately, to get diagnosis is a privilege. So however we can, help everybody out, that's what we should do. Maybe I should get into politics. I don't like politics, but I don't know. We gotta make change somehow. Michelle, I appreciate you. Thank you so much. Um, I'm trying to go back up and get some of these questions. I love sticky notes. Uh, how do I get my fiance to focus on one task at a time? So Juanita, here's the funny thing. We can't get our partners to do anything. You can't. That's the answer. You can't. So what can you do on your end that will make you less frustrated about the fact that your fiance is all over the place? So that's what I want to know, Juanita. Let's focus on that. But have empathy for your. Of course, like he needs boundaries. Like, hey, do your thing, but like on Thursdays we do this, on Fridays we do that. But you can't change your partner, right? You just kind of pick your partner. It's scary. Like you live what 25 years, 30 years, and then you meet somebody, you date them for a year and a half, whatever, and then you spend the rest of your life with them. That freaks me out. You know, like I hope to get married one day. But it's kind of freaky, right? Um, Let me see. My spouse stubborn AF a week. Oh! Let me thank you for the stars. I appreciate you. Be single and get a dog. Sometimes I don't know if it's me or him in a relationship. I feel when I go through episodes, I want to be single and not care about taking care of another human being. I tend to dissociate. All right, so Karina, I'm not sure what episodes you're talking about, but this is look. First of all, this is why I'm so fortunate that I get to do this right with mental health, where I can answer you all's questions, and I'm thankful to Facebook for giving me this platform. I'm thankful for y'all. We're getting close to what 3 million followers total. People need to hear about this type of stuff, right? Because you're saying that you're having an episode and you don't like. To be honest with you, like, let's say I was in your position, like I don't know what type of episode you're having, but let's say I was having like a manic episode, right? I would probably also want to be single too, because I wouldn't want to have to take care of anybody, and at the same time, I may be ashamed to let like my girlfriend or my wife see me in this position where like I'm not fully myself. But like if you detach yourself completely away from the relationship, you have to take into account how your partner feels, and then they're thinking, oh, every time you go through an episode, not that they're judging you, but are you gonna like love me less or like pull away? So we have to make it okay for like you to have an episode, and then find a way. You're gonna have to have a tough conversation to get over this hurdle, but find a way to have that conversation with your partner and say, "Hey, when this happens, I feel I'm kind of ashamed to be around you, but I want to be with you, so that way you can get some space, but you don't have to like separate, because you don't want to damage the relationship long term, and I know you don't want to do that. So those are my thoughts. Um, Zoe, stop looking yourself. Brittany Scott, who's Brittany Scott? I'm trying to think. Did I go to school with Brittany? Let me see. Is how I get a doctor to take my film seriously. I have to get another doctor. If you're going to the same one over and over and they're not listening, is being very forgetful related to ADHD. It could be, but something like lack of sleep could also, and depression could impair your concentration, or a medical condition. A lot of things can impair, your concentration, and it could make you more forgetful. Um, Let me see. TR says, I'm advocate for TR. I appreciate you. Thank you. It's a common for people with ADHD to jump around jobs. I love my last job. Yeah. So, Sarah, I see that a lot with people with ADHD. Sometimes, especially when you're not like stimulated at your job, you may feel the tendency to jump ship, and then it makes things difficult, right? You had 4 jobs in the span of 16 months, and now it's time to do taxes, and everything is, that's why life can be so difficult. Let me get some of these questions. Um, see Zoe. Yeah, I can bring Zoe out. She's right there. I'm about to get her. And I'll do the dance. I try to go back and get some of these uh, questions. How did hear you? You got it. You got it. Any advice for sleeping when my anxiety is acting up? I haven't been able to sleep for a couple of days. All right, so uh, Ella, look, a lot of people struggle with this. Even sometimes I'm like, I gotta get to sleep. So having a nighttime routine for sleep can be very helpful, right? So starting to put your phone away at a certain time, maybe taking a shower, maybe lighting a candle. Some people will take melatonin or Benadryl. Like, I can't legally tell you to do that or not to do that. But those are things that, like, we would do for people at the hospital. Melatonin is like naturally occurring in the body. Um, so some practitioners kind of prefer that to Benadryl. I think Benadryl is more potent, but also long-term use of drugs like that could cause like memory issues long term. But like there's a very real chance that like professional help could be warranted in this situation. Because if anxiety is the main thing driving you to insomnia, right? Then until we really fix that issue, like maybe you'll have a new routine, take melatonin or do something that your doctor tells you to do, right? Or a friend or something that you feel like you should do. But until you get to the root of the issue, you may continue to have the insomnia. And the dance, I appreciate you, Mike. Appreciate you. Chronic nightmares. All right, so best treatment for chronic nightmares. So Robin, it's tough to just answer that straight up. So like, I mean, if obviously like if I wasn't in this social media like context right now, like if I was talking to a patient, like I'd be asking so many questions to try and get a handle on the nightmares. Like, is it situational? Is it like flashbacks? Like, am I thinking PTSD? Like, I'll ask a lot of questions, but um, you know, uh, therapy sometimes is helpful. We use a medication called prazosin sometimes for this reason. So those are some things that you could possibly take back to your doctor. Um, okay, all right. So best therapy for SH. Trying to pinpoint my found. So I hope we can talk about this on Facebook. Um, but I think this depends on the person, right? It really, in my experience, it depends on the person. You have to figure out what's going on, in their life and how they best want the help. But having a therapeutic activity to replace the SH could be helpful. Zoe, come back, Zoe. Zoe, come here, baby. Why you going away from me, Zoe? Come on. They want to see. They want to see you, Zoe. They want to see you, Zoe. How I balance my meds. I'm just eating. My meds ruin my appetite and sometimes don't work together. All right, so man, because you said meds, like it'd be good to tell your doctor. I always tell people, tell your doctor exactly what you're taking. Don't be embarrassed to say, I take this or I smoke that. Like, it's very important to tell your doctor that, right? Because my meds ruin my appetite. I'm not sure if you're talking about stimulants or something like that. Um, but like I always tell people, like not even just my patients, but anybody. I'm like, hey, if you're taking anything that's not prescribed to you by that doctor, please run it by them, and they would be in the best position to answer that question. Zoe Shiesty, what do you use to sleep, quiet your mind? So I mean, melatonin. I will take melatonin every now and then. And it's funny because I'm doing a campaign with CVS. They sent me some melatonin. I'm like, okay, awesome. Like I hadn't had to buy any in a long time. Because I've just been sleeping naturally. I always prefer to sleep naturally. So normally, what I would do is like take a shower. Like a nice long shower. So a shower can help, or sometimes the Mickey Picky will get you right. But a shower is normally a shower and like listening to some music that's like laid back and like this kind of like maybe looking at pictures of my family, and just kind of like ending the night on a good note. That helps me a lot of times. How do I describe my age? So Emily, really important question that you asked here. Describe your symptoms in the best way, in the most authentic way to you. Don't worry about if the doctor say that you're seeking drugs, right? Because you're going there for help. The doctor's there to help you. Like, they went to school for a long time to help you, Emily. So well, some people think you're seeking drugs, maybe so, but that shouldn't be somebody that you would want to see. Like, you're in there because you need help. And the right doctor will understand that, and they're not going to judge you for that. Do you receive patients? I was in like 4 or 5 states. I'm not at the moment. My schedule was busy, busy, busy AF. Um, after. All right, so if you really get down, that's fine. You can get down, so. My son has ADHD and ODD. How can I help him? His love disrespect is getting out of hand. All right, so Mary, here's the thing. ADHD doesn't allow people to be disrespectful, right? Um, I mean, disrespect is never tolerated in any circumstance, like, regardless. With that being said, not that you have to negotiate, but you have to find a way to talk his language, right? And like, he could really be struggling silently, and sometimes, like, with I'm not saying your son has depression, please, like, I want to be clear with that, but I'm saying ADHD sometimes comes with a host of other things like ODD, like a depression. So if he's struggling silently, like, it might come out as irritability or rudeness. So if you can, disrespect is still never tolerated, but maybe if you can meet him halfway and try and speak his language and try and get to the bottom of what's going on, especially if he's not normally disrespectful. Like, why is he doing this out of nowhere? Zoe, sit down. Zoe, sit down. Is there medication that helps with anger issues? Uh, so I mean, the patient came in, like, I was at the psychiatric hospital, and they came in with anger issues. Like, I would need a diagnosis. I mean, if they're aggressive, we use like uh, antipsychotics. That's like the fastest way to help somebody who's aggressive. We give medications like Gedon, Risperdal, Haldol. Zyprexa was like one of my favorites back at the hospital. I hope that answers your question. Does that answer that question? Um, uh, how would you treat an ADHD patient who was self-medicating until they realized they have ADHD? Does disclosure of past drug use automatically disqualify someone from getting help? Um, in my opinion, no. And but also at the same time, I do think that me and all the the, like, content creators who are medical professionals who post about ADHD online, I believe that we know more about ADHD than probably 80 or 90% of the clinicians out there. Like, you know, they don't teach you a lot about ADHD in school. Um, and in my opinion, like, because I know about ADHD, I know that being having ADHD, undiagnosed ADHD, as in your youth, could lead to substance use, right? So sometimes, if they had the proper treatment and medications to support, they may not be using. So I don't think that a past history is disqualifies anybody. But that's my personal opinion. That's my personal opinion. My husband is Nigerian, doesn't take mental health very seriously. What do you recommend? So, TR, this is a very difficult and a very personal question for me, because you know my family is also African. We're from Ghana, West Africa, and mental health is not taken seriously. You know, the thing I would say is, try to burn yourself out, but be very clear with your boundaries and say, hey, like, this is something I'm doing for me. If you don't believe in it, like, this is something that I'm doing. And at some point, with the way the world is going, they will understand mental health at some point. But it was never taught in schools, right? Even for us here in the States. So this is something that I'm actively working on. Like Zoe, all of this social media success. Uh, I mean, people watch it everywhere, but I don't feel like it's really extending to my people back home in Africa. So I'm thinking and scheming and trying to figure out ways to help people back my home country, because I think we're really behind. Like, if people think we're behind here, I think it's arguably worse. In Nigeria, Ghana, West Africa. So, like, I feel you on this question, Tierra. I feel you. No problem. You're feeling on Ambien. So, one thing I don't want to do on here, I did do this like when I first started on TikTok. I don't want to give like, well, I mentioned what Zyprexa earlier. So, I mean, if I've used the medication a lot in my past for my patients, I'll mention it, but I don't want to like be endorsing something or say, "Oh, I hate a certain medication." Ambien is there for a reason. There's an indication for it. So as long as it's being taken properly and it's been prescribed by a provider, who's board certified and all that, then I think that's cool. Sherry K, thank you for having me. I appreciate you. I have ADHD. I have a really hard time enjoying sex to the point where my entire life I could care less if I'm sexually active or not. What can I do about this? I feel like it's ruining many relationships. I have a very hard time explaining how I feel without making the other person feel like it's them. My boyfriend doesn't seem to age very seriously. I think it cannot possibly be related. All right, so Alexis, here's the thing. First of all, this does not mean that you have to automatically break up with your boyfriend. All right, but in order for you all to progress in a relationship, there has to be some type of understanding because and I'm a positive person, so but I do have to let you know if there's no understanding, at some point you're gonna get to the place where you're evolving as a human being and you're gonna get to like life is ups and downs, right? You're gonna get to ups where things are great, but then with the lows, you're gonna need a lot of support. So when you need support and somebody doesn't understand what you're going through, this is how you have people who are in relationships but they feel super lonely. Like you can be in a room full of people and feel super lonely. So your support needs to like you need more support, regardless, especially from him too. So a couple of things going on. So that number one, right? He needs to know that this is an issue for you. Number two, with a hard time enjoying sex, like this is where like I would go to like a professional and figure out what's going on, right? Like, is there an underlying cause? And like I would start off by going to like your primary care provider, let them check you out, like yearly physical, let them run all the tests, all the panels, check your vitamin D, make sure nothing is off, the whole nine. And then, like see if you can, right? See somebody from psychiatrist, or nurse practitioner or a PA, but somebody who has that like specialty in psychiatry, and see if they can get to the bottom of it. Let me see. Amanda, I appreciate you. Have a good night. Thank you so much. Uh, Snow says, "Hey, can you see my comment?" Snow, I see your comment. You're on live. I appreciate you. So I have ADHD and anxiety. Most days I just feel awful, like sick to my stomach, or like I have a cloudy head, or like I'm a drained battery. Could they factor into not feeling good most days? So Lexi, this is a very difficult question for me to answer because sometimes like I just don't know what's going on with you, right? Like I just don't know, right? And it's easy for people to say, oh, that's an ADHD thing or an anxiety thing, right? But if I'm commenting, with my professional background and like I don't know I don't know the situation, so I don't know. I mean, of course, ADHD can make you feel like you're drained towards the end of the day, but I'm not sure if there's a correlation here. I'd rather tell you that I don't know than to like lie to you or something. Both my girlfriend and I have BPD and lost someone these last 2 weeks. And oh dang, sorry, Travis. Sorry to hear that. It's difficult. She copes with it by not dealing or thinking about it, and I only use anger as a coping mechanism. How can we fix this? What should we do? All right, so Travis, so especially with something like BPD, I want you to give yourself credit, right? Okay. Thought my assistant messaged me. Give yourself credit for understanding that there's a problem. Like you're ahead of a lot of people. You know that something's going on and you're fighting for a solution. So that's 50% of the work done. So Travis, you're making a lot of progress right here. Now with the anger, like it's human to feel, right? And that's fine. But if you can have what's a permissible way of expressing your anger, right? Like we know that we don't want to raise our voice or punch things or put our hands on people, whatever. But is there a way to get your anger out in a way that's therapeutic for you? That's what I would say on your end. And on her end, sometimes leading by example. If you like you struggle with anger, but you're able to, like, how to go through something as opposed to going around it, and try to lead by example and say, hey, like, offer your experience. Like, hey, we lost so and so 2 weeks ago. It's been difficult for me, but I'm doing this and I'm making a little bit of progress each and every day, right? And hope that she follows behind you, But and once again, like, this is all educational information that I would give like a student if we're doing like a hypothetical case study or something like that. But either way, whether my answer is helpful or not helpful, I just want you to know that, like, the situation can be solved, But you have to believe before, like, things get better, in my opinion. Um, Let me see. This, it's a good question, Rebecca. Uh, so I mentioned Zyprexa earlier. That's been one of the most helpful medications for me. But my patients will always complain about the weight gain, and I would always tell them that, like, you can almost expect it to happen. Antipsychotics that do not cause weight gain. I feel like I'm on Jeopardy. Uh, I would say, in my experience, in my experience, like, risperidone was not, like, Zyprexa was by far in a way like the worst when it came to weight gain. Risperidone had been was decent. Haldol was pretty weight neutral for me. Um, Geodon, Ziprasidone and Lorazone were pretty weight neutral for me. I feel like I had a lot of. I mean, maybe I just prescribe a lot of Zyprexa. I don't know, but, like, that was the main thing with Zyprexa. But you do see it. Any antipsychotic can theoretically, make you put on weight, right? That's a good question right there. Mickey Ficky. What a good question. Yeah. Rebecca, I love that question. I love that question. How do you handle postpartum depression when you struggle with ADHD, manic depression, anxiety? I feel like I'm drowning, so I can't find a therapist. I understand, like you. Katerina, so sorry to hear about that. That's a lot going on all at once. All right, so let's break it down. Postpartum depression, ADHD, manic depression. So, like, bipolar disorder, or mood disorder, anxiety. I feel like I'm drowning. All right, the so I don't know where you're at, and I do know that it can be difficult to find a therapist wherever you are. The first thing that I want you to do is to make sure that, like, you're safe. Make sure that you're taking care of yourself. That you're doing the minimum, right? Like, if depression is really, like if depression is, like, kicking your ass, like, for real, like, make sure that, like, you're the bare minimum. If you can get out of bed, brush your teeth, do a couple of things, and hop back in the bed. Give yourself credit for that. Like, you have to count all the small wins, and do that as you're looking for help, right? And understand that if it's a situation that's urgent, like if it's an emergent situation, like, go to the ER if the depression's, like, really, really getting out of hand. But if you're managing it, but, like, you feel like you're drowning, count up all the victories while you're still looking for the professional help in the area. Uh, Seroquel. Oh, I forgot all about Seroquel. Yeah, Seroquel was, in my experience, it did tend to, you know, um, put some weight on, my patients. But the thing with Seroquel is, I mean, not everybody's taking 4, 6, 800 milligrams. Sometimes take like 25 or 50 for insomnia. So, we're able to, like, dose, like, kind of lower. And if you know nothing about Seroquel, then I apologize, because that part was probably confusing. I try and make uh, my answers relatable. I'm sorry people can understand it. Need some more questions. So, ooh, Erica, I'm not shocked. We see this type of stuff all the time in the hospital. Yeah, look, Michelle, look, if somebody's severely depressed and you're having a hard time, like, depression is one of the biggest causes of, like disability, people missing work, and people, having lost income, like, people with depression, compared to their peers, like, you're gonna make less, because, like, depression is holding you down. So if you can get out of bed and you can uh, do a couple of things or one, and you go back to bed, give yourself credit, right? Like if you're a writer, you get up and you write like a paragraph, right? You write a paragraph, and you go back into bed. That's fine. Like I'd rather you do that. If you're a musician, I'd rather you get out of bed. Let's go through the day. Like I got my guitar. Get out of bed. Go ahead. You know, play something small. Play something small, and then keep it moving, right? Write some lyrics or something that you can be proud of. You have to be proud of something that you do, even if you hop back in the bed, right? Because like it's important to like tally up the small ones. It's very important to do that. It sounds silly, but it's important. What do you recommend to help get up and get more active and do more? So an accountability partner is helpful because if you have somebody and y'all are gonna like run 3 times a week, you don't want to be left out. So that's the first thing that comes to mind. But sometimes even just like going for a walk in the morning, like keep it super simple. Like if you're already struggling, like let it be simple. EP is offered. Sydney, what's up? Oh, Leilani, you must not have been around in the early TikTok days. Yeah, I'll do a live one day where I'll just play guitar. I will definitely do that. He writes a song about being on the spectrum, ADHD. So I already have a song about ADHD on my current album, but I'll take a picture and maybe I can write something about being on the spectrum or depression. I get out of bed post work. Hey, Michelle, at least you did it. At least you did it. Let me see. Have you heard of patients taking a stimulant and Strattera together? I've heard of it a couple of times, but it's not something that we really do for real like that. But I mean, if your provider has prescribed that to you, then like please follow like what your provider has prescribed. But I don't see this too often. I don't see it too often. Um, Somebody had a question. Yeah, I was doing that at one point. I got slammed. I got so busy. I had to bring on more systems and stuff. 21 diagnosed. Uh, Go back on his meds. He stopped when he was 16. Muriel, from what it sounds here, like I don't know whether he should go back on the meds, but at least exploring all options, right, including going back on the meds, can be very helpful, right? And sometimes it's hard for people to go back on. Like, let's say you were taking like Adderall when you were 12, and then you're becoming an adult. Like as like you're a teen, people are telling you, oh, like you're gonna grow out of ADHD. When you're an adult, like you won't need this stuff. Sometimes you hear that a lot. So when you become an adult and you have to go back on something that you took as a kid, like that person has to like like accept that once again. But that could be like the game changer for him. Uh, Mariel, that could be the game changer. No, TikTok. I might do like a joint live where I'm on TikTok and then on uh, Facebook. But like I'll probably just be live on Facebook from my phone and just play guitar for 30 minutes or something like that. Does Effexor work for ADHD? So I mean I don't prescribe Effexor for ADHD. I prescribe it more so for depression. But I mean maybe there's ADHD and depression. So like I'm not sure like all what's going on here. Oh, the album is on Apple Music, Amazon Music, Spotify. It's called "I Feel Better Now," and I actually have a like a small promo to play. Why I get the dog up, but I'll play that a little bit later. Thank you so much. Looks like some people didn't know about the album. I appreciate y'all. Our opinion on client benefit for anxiety and addictive qualities. I subscribe without knowing addictive qualities at 17 and taper down, but so Sydney, I can't legally recommend like a substitute, so I have to like follow like the guidelines, because to Facebook and YouTube and like to all these things, I'm a content creator, right? I can't step into that clinician role. But opinion on clonazepam, I mean, it could be a good medication. I don't want to demonize any one particular medication, But I mean, just as a talking point, you, if I'm giving somebody a medication like this, I will tell them like, hey, take it, boom, 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 as needed, whatever, blah, blah, blah. But I will let them know that this is a medication that like you can build tolerance up to it. It can be addictive. Like I would let them know all those things. And I mean, there's definitely a place for them, but I personally, I don't like, I don't like to start off with benzos, right? Like I like to, I like to try other things, Visceral, antidepressants, Buspar. I don't like jumping straight to benzos. Where are you doing sign call? Kendra, the world is opening. Well, actually, I don't know. Ho- Hopefully things are getting to normal. Let me say that. So if we're able to do that, hopefully I'll have some public events, and I will definitely let you all know. Uh, Joanna, how you doing? Uh, Let me see if I missed any. Cindy, no problem. I appreciate you. Let me see homeopathic treatments. So, Leilani, I believe that there's more, like, with all the evidence-based information that we have, there's more out there that could be therapeutic. So, like, I want to know more about the homeopathic treatments. I want to know more about psychedelics. I want to know more about, as it relates to mental health, right? I'm talking about like from an evidence-based perspective, not like somebody saying, "Oh, so for everybody," but like I want to know more about, cannabis. I want to know more about, these things. So like I would hope that maybe one day I'll get to do a study with university, and they'll pour money into research, and we can really research these things and see if like head to head, this versus the antidepressant, what's better. But I'm a big fan of, and I had posted a video about cannabis a while back, and somebody said I was judging. I wasn't judging. Like I'm actually a fan of studying it more. But my thing is like, if you're board certified, like you can't just be like recommending anything, right? Like it has to be evidence based. Even if I'm making like a funny video and I'm joking online and it has a little bit of medical content, I have to make sure that it's evidence based, because the worst thing you can do is like provide some bad information, to people who like y'all might just take it for real. Uh, Personality changes without. So here's the thing. I mean, people say personality changes with Adderall, but like the medications, they're not supposed to change your personality, right? But it's like maybe if you were like super like talkative and like all over the place, maybe taking the medication like brings you back to equilibrium where like you're calmer, and that might be seen as a personality change. Or maybe if you're somebody who you're not the most talkative, and then you take your medication, all of a sudden you want to talk until your medications wear off, like that's medication. But I don't think it's like I don't know if it's a personality change, but I can see how it feels as if it is a personality change, if that makes sense, Don. Uh, Andrea. Is it Andrea or Andrea? Whenever I see this name, I don't know how to proceed. Andrea, like A, like and, like one and two, or Andrea. Okay, I'm getting distracted. All right, I noticed a tremendous reduction in postpartum depression with second child. I think the main difference was breastfed much longer. Oh, okay, wow. This hormones really helped me. So glad. Um, oh, it was nice to read that. Hey, Brittany says she likes. Let me take a picture because I got excited about that. Brittany's listening to the album. Let's go. I'll just go and take a video. Hey, okay, all right. Hey, shout out to Brittany. Her favorite song is Buffalo Lux, and that's actually my favorite song on the album too. So, Brittany, thank you so much. I just had to do that. Let me go to some of the newer uh, comments. I've seen it pronounced confusing name. All right, so I'm trying to figure out, is it Andrea or Andrea? Andre. All right. Okay. All right. While I'm trying to figure that out, I'm gonna lose out on these questions. Breastfeeding. body hormone. Like the fact that it would make the postpartum depression not as bad. I think that's interesting. Also, Don says, can like the Adderall make you introverted? So, not to my knowledge, but you might feel as if you're more withdrawn, right? Like you can have mood changes. Like I definitely see that with stimulants, right? But I can see how somebody would say that they feel like they're introverted after starting a stimulant medication. Um, no, you haven't missed the cheers break. Normally it's around the 40-minute mark, but you haven't um, uh, missed it. We'll do our break shortly. I gotta get the dog up. Um, love the awareness. And Steve, I will say that I agree with you. The videos that we put out, like, it's all scripted. So yeah, but I hope that shows you all that having a partner who understands like ADHD is like, if you're single right now, if y'all are watching and you're single right now, like before you get to that next relationship, that should be a non-negotiable. You know, water break coming soon. Water break coming soon. Psychedelics. Oh, Josh, I definitely think that there could be a place for psychedelics in mental health. You know, provided we do the research. And I think I saw a question I wanted to. Um, Sydney, I appreciate you. Thank you so much. I appreciate Sydney. And Max has this question here. 80. Okay. Max, actually, let me just answer right now. If you tell them that and they reject you, not the lady for you. Not the lady for you. You shouldn't have to spend any second trying to convince anybody that they want you. Like my thing, like let's say I'm talking to a brand new lady, right? I meet some chick in LA. I'm like, oh, this chick is dope. I'm like, I'm finna take you out to wherever. And she's like, I don't like you. Like if I get that, for me, that's not a bad thing, right? Like rejection, the reason why I'm saying it's not a bad thing because I think the worst thing that can happen is somebody stringing you along and then you're like you're wasting all your time. You know, Max, you got your answer. They said ADHD, boom, boom, boom. They want to be with you. That's fine. You know, you got something better coming for you. Like that should be water under the bridge. But I do understand that like with ADHD, rejection can feel rejection feels very heavy. So, you know, I don't want to dismiss what you're going through. So definitely go through it, process all of your emotions, you know, but understand that at the end of the day, you need somebody who wants to support you. Okay. All right. So all right. So let me, while I get the dog up, let me go ahead and, how about I put in this video real quick? Share. Hey, there we go. All right. So this right here is a preview to the ADHD music video. And I haven't even announced anything about it. So the 98 people who are watching right now, this is the official announcement for the ADHD music video. It's gonna come out next week, Wednesday. We worked on this for a long time. I'm so excited for it to come out. But here's a small preview of the music video. And while y'all are watching that, I will go put the dog in the kennel. We gonna be super. All right. Hold on, let me do it correctly. I want it to look good. All right, I think that's it. All right, let me check real quick. All right. Okay. All right. So here's a preview for the ADHD music video. Let's get it. We gonna be superstars, but we done had a lot of scars. You know, life is hard for me. Hey. We gonna be superstars. It's Dr. K. Hey. We done had a lot of scars. And that kid Rob. We gonna be superstars. We done had a lot of scars. Let me see if y'all can get back to me. How'd y'all like that video? How'd y'all like that video? Eric, I appreciate that. I appreciate it. The lion says, I appreciate it. Thank you so much. Yeah. The video of the day, we actually might have to go back to that because I really like that concept. Lisa says, all right, let me answer a couple of questions real quick. Tell me the truth about benzos. I wasn't told. Oh, Lisa, I just told that person if you watched the live earlier. Like I never start off with benzos first. Yeah, like I'll never really do that. Yeah, and I'll let people know exactly why. Support my wife with bipolar depression. How do I help myself while caring for her? Boundaries are important. And when you feel like you need extra help, bringing more people, more resources. Sometimes one person can't get it all done, right? So maybe professional help. And then like if you understand bipolar disorder, that's already a huge advantage, Mike. Because a lot of people don't understand it, right? So you understanding it, like it puts you in a better position to help her out. And at least in my experience with my patients who have had bipolar disorder, the depressed phase is like the worst from what I've heard. And like you, most folks would rather be manic because you're at least productive, even though you're manic. All right, listen to every day. What's my dog doing up there? All right, and yeah, TR. I have ADHD. I talk about that a lot, and I think I ran out of water, y'all. So I'll probably have to go buy some from the store. Zoe, oh my gosh, Zoe, you really gonna bark again? Let me get a few more questions. We speak about PTSD, trauma. I feel like I've already done that before, but I can do that. Oh, Mickey Ficky. Actually, I'm not ready to end the live, so I'll be right back. So, Shiesty, you look like Blippi. All right, where and no surprise. Mike, I appreciate you. I enjoy doing this. This is my way of giving back to my community. You all have really like changed my life and given me this amazing platform, and I get to do a lot of cool things because of it. So this is like the least I could do. You know, oh, I'm weak. Is it normal to be told you are slow and not enough? Uh, I mean, Josh, some people are just assholes. I mean, that's the best I'll say about that. Like, some people just suck, right? Or maybe they're joking. Maybe they're friends with. I don't know. Like, if they're telling you that a lot, I mean, that ain't your friend. Water break. What? All right. Somebody drop the magic word in there while I read this. I love TikToks. Was jumping on your live for the first time. Should I like Texas? I struggle with ADHD, depression, and then 4 kids. Ooh, 4 kids. Very supportive husband. That's a plus. It's a struggle every day, but with a mix of relating advice from you and me, others, and I'm saying, Sarah. I appreciate this. Like, I'm gonna have to like start throwing in this ask format because there's so many questions I want to get. Like, this is the best way for me to get the questions. Like, just put it all in front of me, like during this live stream. Um, oh, okay. Magic word here. Cheers. Cheers. I did find some water. Let's see. All right. I'll do that some more. Okay. All right. I got. I gotta get off. Was it? Okay. Then. All right. I gotta get off, y'all. It's say Thursday. Today's Thursday, y'all. So we'll be back around on Monday for the show once again. I appreciate you all. It's super fun when I get to do this. And yeah, I will see you all then. So thank you so much for your attention, those of y'all who have stuck around. And if you're watching this on the back end, thank you so much. I really appreciate it. And for those who are, watching right now, hope y'all have a fantastic night. Take it easy. Do what you can to get from today till tomorrow. And then we keep doing that. So once again, Tiana says, it is Friday on the East Coast. You're right. It is Friday on the East Coast. All right. Y'all take care. All right. Love y'all.